right, so welcome everyone, and thank you for joining us for today's webinar. My name is Archana Castellino. I'm the National Director of the Dystonia Medical Research Foundation Canada. And I'm thrilled to announce our Supporting Dystonia Patients During the COVID-19 Pandemic webinar series that DMR of Canada is hosting in partnership with Allergan and Abbvie Company. And today I'm joined by our former executive director, Stephanie Ince, whom you very well know. Stephanie and I are thrilled to have you with us today. We'll just share my slides. All right, a short overview of our organization. The DMR of Canada was founded in 1976 by Sam and Fran Belsberg after their daughter Sherry was diagnosed with dystonia. There was very little known back then. Our mission focuses on three areas: advancing research, raising awareness of the disorder, and supporting the needs and well-being of affected individuals and their families. Thanks to our community and our supporters, together we've come a long way in all these areas. Just a little housekeeping before we get started. First, a very important reminder that this is a webinar presentation that aims to provide dystonia patients and caregivers with information for support during the COVID-19 pandemic. We urge you to speak with your doctor or neurologist for a complete examination and to remember that you are in control of your health. A recording of this presentation will be made available and emailed to all of you once it is available online. Regarding questions, as you know, we've collected your thoughts in advance of this session and have already shared some with Dr. Nguyen to help him with the development of this presentation. As well, we will ensure we have lots of time for Dr. Nguyen to answer the most frequently asked questions. So if you do have a question during the presentation, please feel free to type that in the Q&A section that you should see at the bottom of your screen. My colleague Stephanie will monitor these questions throughout the presentation and will bring this to Dr. Nguyen's attention at the appropriate time. There is also a chat function. Please feel free to use that to say hi to the others who are joining us today and to introduce yourself. But a reminder that we will not be monitoring the chat box for questions. All questions for Dr. Nguyen should be sent through the Q&A box. We would appreciate your feedback on today's webinar too at the end of this session. You can send that to me directly via the chat function. A little background about the survey that we conducted back in August. We've all seen how COVID-19 has changed the lives of many. We at DMR of Canada have been in touch with the community throughout the pandemic and realized that the impacts of it on the dystonia community were significant. Given our foundation's mandate and mission, we needed to get to the heart of the matter to determine the needs of the dystonia community. So we developed the survey to understand how COVID-19 impacted the lives and overall well-being of people living with dystonia. The survey ran for 3 weeks and many of the questions were retroactive. The high-level findings were as follows. Now, 82% described that their mental health was good to excellent before the pandemic. However, that changed when the pandemic was declared in March 2020. 63% reported stress and mental health issues, and 28% reported that their ability to be physically active was affected. Overall, 50% of respondents reported a negative impact on their health and well-being as a result of COVID-19. And in addition to that, they also included issues with access to healthcare and treatments. The survey helped highlight the need for tools to help with self-management of dystonia and to improve mental health. Based on these needs and in an effort to empower the community to make the most of their situation during the pandemic, DMR of Canada has developed this webinar series. Now, a lot has changed since we surveyed the community last. And as we continue to face challenges of the pandemic, we wanted to check in with you again. So to address the community's healthcare needs and in line with our topic for today, I will now ask some poll questions. You will see a screen pop up right now, and please don't worry about your answers for these polls. The answers that you submit will be submitted to us anonymously. And I have opened the poll right now. Okay, thank you everyone for your answers. I hope you can all see the poll results. Stephanie, can you confirm that for me, please?
Yeah, we can
perfect.
see.
Thank you. So our first question was, how comfortable do you feel visiting a healthcare facility? So we have 30% who answered very, but about over 60% who was somewhat or not comfortable at this time. Then we also have challenges. So most of the challenges we see are anxiety or stress related to COVID, and then some physical mobility, some family, and a few said financial. And then we have our third answer, which is which of the resources is served to be most useful. You say video conference, use of medical apps, internet resources have been very useful, and online forums. For those who have answered other, we would like to hear more about these other resources and support that you found helpful. So if you could perhaps later type that in our chat box, we would really appreciate it. And for those who have shared resources on internet resources, if you could probably expand on that in the chat function, that would be great too. We try to refine our resources available on our website, so this information would help us. And then finally, we have tools or support that would help alleviate some of the difficulties that you are now experiencing. So we have, in our top, we have managing stress, and then we have pain and wellness at the same. And finally, it's other mental health at 46%.
Specifically related to the pandemic.
Yes, specifically related to the pandemic. Thank you, everyone, for sharing your feedback. And I'm sure this is going to be useful for Dr. Nguyen as he presents on the topic today. So I will stop sharing results, and I will now turn it over to Stephanie to introduce our topic and our speaker for today. Over to you, Stephanie.
Thanks, Archana. Hi, everyone. It's nice to have everybody here with us today. Thank you so much for your feedback so far, and we're looking forward to another great session. So as Archana mentioned, today we are presenting the first in a two-part webinar series that's designed to help support the dystonia community during the COVID-19 pandemic. Our topic for today is making the most of your visit with your movement disorder specialist, recognizing that the world has changed. And we're very lucky to have with us Dr. Dung Nguyen. Welcome, Dung. Thanks so much for being here. And just so that the community that's here with us today can hear a little bit more about Dung and what's brought him to us, I just want to share a brief bio with you. So as you all know, at the foundation, we're very supportive of young early investigators committing to the field of dystonia. It's obviously really important for us in our mission to ultimately find a cure for this disorder. And so we were thrilled when Dung came forward and suggested that he would be interested in hosting this webinar for us. Dr. Nguyen received his undergraduate training in biochemistry at the University of Manitoba, and he completed a Master of Science in Neuroscience at the University of Toronto. He completed his medical school and residency in neurology at the University of Manitoba. And he is currently a movement disorders fellow at the Movement Disorder Clinic at Deer Lodge in Winnipeg, Manitoba, under the mentorship of Dr. Sean Udow and Dr. Doug Hobson, who I'm sure many of you are familiar with. So in this position, Dr. Nguyen works with a multidisciplinary team, including doctors, specialty nursing, physiotherapy, occupational therapy, speech pathology and dietitians. He's very passionate about helping patients and the dystonia community specifically, and I think was very keen to have the opportunity to engage with this community one-on-one to, first of all, hopefully empower and share with you some of the information that will be hopefully useful to you over the next few months. And in addition, I know he's really looking forward to hearing directly from the patient community about what your concerns and needs are. So without further ado, I will turn things over to you, Dung.
Thank you very much, Stephanie. Please give me a second to share my screen. And please let me know if you can see the slides correctly. Today, there was some issue with Zoom that you can see a black bar. Good afternoon, everyone. It's an honor for me to be here today to talk to you about dystonia and how we can make the most of your visit with your movement disorder specialist. I have no conflict of interest. Dystonia is a very heterogeneous condition. It is a movement disorder characterized by sustained or intermittent muscle contraction and causing abnormal and often repetitive movements and abnormal postures. The dystonic movement is often patterned, twisting, or maybe tremulous. And dystonia is often initially worsened by voluntary action or associated overflow of muscle action. And I know some of you, many of you may have different type of dystonia because it's such a heterogeneous condition. You can have blepharospasm, you can have laryngeal dystonia or mandibular dystonia or general dystonia. In this video, I show this patient has a very task-specific dystonia where she would have jaw dystonia whenever she tried to drink water, but it can become very generalized in some patients. And in this case here, we can see that a young patient with dystonia, generalized dystonia, and you can see that her feet are turning inward, and we can also will see that as she walked there, also her feet are moving inward, and there are some dystonia in her bilateral hands as well. So we know a lot in terms of dystonia, in terms of where they can occur and how it is observed in to us. And we also know a little bit about the neuroanatomy and how the neuroanatomy is affected, leading to what we observe in terms of the dystonia. What we don't know a lot about is how the microcircuitry of the brain is functioning, or how the microcircuitry are being wired abnormally that result in what we see as in the dystonia. And many of us, and many of you have asked questions, my dystonia is a genetic. Are there a cure for the genetics? There are more than 100 causes of dystonia, and many of them are genetic causes. Unfortunately, we are at the stage of discovering the gene that's causing dystonia, but we don't know how that dystonia or how the abnormality in the gene led to the abnormal circuitry and how that result in your dystonia. And all that is still a big topic of investigation. That's a brief overview of our understanding of dystonia from the movement disorder specialist perspective. I think it's important for me to talk to you today in regards that how we approach the diagnosis of dystonia. What do we aim to do when we treat dystonia? And how do we usually do that in a regular pre-pandemic time? And how the pandemic has changed the way that we practice. And by having an understanding of where we as movement disorder specialists, a care provider, coming from, and how that is the pandemic's affecting us. Hopefully, that will give you some thought and also empower you to allow us and to let us know how we could care for you and provide better care for you, particularly in this difficult time. So when we approach a diagnosis of dystonia or any movement disorder, it's very important we listen to you, what you really tell us. So in terms of when did the symptoms start? How did it start? Where does it affect you? How long does it last? Is it getting better? Is it getting worse? If it's come and goes, how often does it come and goes? And are you feeling worse over time, or are you feeling better over time? And then, do you have some of the features that we ask you for? Slowness in movement, any changes in your skin, any changes in your system, your eyes, your liver, your muscles. Do you have any tremor? And then your past medical history is important. Your medication, what you're taking is important, and your family history. So that's what you tell us. In addition to that, obviously, what we do in the neurological exam, we test your cranial nerves, your muscles, your movements, and take into account with the investigation, blood work, brain imaging, and genetic testing if it's possible, and or if that is feasible in particular province or territory that we live in. And like I mentioned earlier, a lot of the time that when we do in medicine, we do not have a particular test to say, hi, you have this condition or you have that condition. A lot of our time spent in training allow us to have pattern recognition, in the sense that take into account what you tell us, what we see during the physical exam and the investigation. We're putting that together into a pattern recognition and allows us to provide a diagnosis. Now, one thing that we is often not emphasized, that the privilege to follow you over time, to see how the condition progress or stabilize or improvement, and that also support or refute our diagnosis. What we always want, or what we always train in medical school and residency, is that we look for any structural lesion on neuroimaging to say or to suggest it could contribute to the cause of the dystonia. We also try to look for reversible causes. We look for treatable causes, and in some cases, genetic causes. Only when the science and the availability of the testing allows us. That's a diagnosis. In addition to that, we look to treat your symptoms. If you have pain symptoms, or you're feeling there's a lot of twisting movements that are affecting you, obviously we will always want to look for to treat the possible underlying cause. I understand that some of this may not be possible, and it can be frustrating to some of you, because no one has found out an underlying cause to your dystonia. And I must say that we're actively, and the science community is actively seeking and trying to find out the causes. And I hope that in the near future we would be able to find out the cause, and then knowing the cause would help us finding out a treatment. What I really try to do in clinic with my patients is actually a holistic approach in treatment. There are pharmacological treatments, but these are mainly, a lot of the time, asymptomatic, to relieve your symptom and make you are less aware of your symptoms. The other part that is often forgotten in a clinic visit is how physiotherapy, occupational therapy, and social worker, our allied health care team, can help you and can provide a holistic care more than just a pills or an injection. And I must say that when we're doing our training, we're not very good in providing the non-pharmacological treatment because that was not the focus of our training. The physiotherapists, occupational therapists are trained in those areas, and we always need their help uh, in uh, in providing us with their expertise, and that's why we like to work in a multidisciplinary environment. With regards to treatment, an important part of treatment is that, first of all, counseling, meaning that to provide a diagnosis and counsel the patients on the treatment. At the same time, look into other things that contribute to the worsening of the symptoms, including how anxiety, depression, stigmatism, and social withdrawal could contribute and worsen your symptoms. And then physical therapy. And within physical therapy, there are many different physical therapies that can uh, relieve symptoms of dystonia. Many of you have talked about if there was any yoga or any exercise that you could do. And one I must say that it can be general, it is general, but I must say is that if the it is the exercise that fits with you, that you enjoy doing it, and that is the exercise that is best for you because it is something that you um, don't dread doing it and you enjoy doing it. And when you enjoy doing something that um, uh, when you enjoy doing something, you will be able to maintain that exercise because exercise not just help dystonia, but also your overall well-being and also help with your cardiovascular health. And having a good cardiovascular health and feeling, a general good feeling, it also helps with your relieving your symptoms and also helps with your mental well-being. Obviously, there are medication that we are often recommend in patient, particularly patient with generalized dystonia, or when they do not want to try botulism toxin injection. Most of the medication are their usage are taken from their use in um, from other purposes. And when these are tried, most of them show some modest effectiveness, about 50 to 60% of people. Their use is often limited by the side effects that they provide to you. So none of these, not all medications would provide you benefit because some of them cause you to experience side effects before there any relief or any benefit. And importantly, there's no good clinical trial that was done to compare these medications to placebo. A lot of these are used off-label, but in some patients, it seems to help, and that's what we have in our arsenal. Many of you have tried or currently receiving botulism toxin injection, and these seems to work quite well, better than medication, and provide little side effects relatively to the systemic medication because botulism toxin injection is at a very focal and local site, and it does not all disseminate or cause you to have systemic side effects. There are other treatments, including surgical procedures, deep brain stimulation, neuroablation, and peripheral nerve surgery. I think what is often underemphasized and understated is that how important it is your for your relationship with your doctor, or how important the relationship between you and your doctor is. Because this is a critical important because when you meet us, you have to trust what we tell you in the sense that what physical examination did we find today? What on the history allows us to make the diagnosis and how the diagnosis arrived and what investigation and what lab work that allows us to make that diagnosis. So this is often is a share decision making as well because based on the information, the shared treatment decision and the treatment only works if you tolerate and if you trust in us to try the treatment. In addition to that, the meeting that we have is a handshake, the face-to-face meeting, the body language, the question that you have for us is of critical importance, because when we have when we have a trust relationship moving forward, it's always important for your care and to provide you with the care that we have, especially in the dystonia where there is no definitive treatment for many of the causes. This map shows you that the movement disorder clinics available across Canada. If I can tell you that, you can see them. There are no clinics that are in northwestern Ontario. There's one clinic in Winnipeg here, but there's no clinic in northern Manitoba. There's no clinic in Nunavut, Northwest Territory, and the Yukon. And the challenge that we encounter even before the pandemics are Canada is quite big of a country, and providing care for people in remote community can be a challenge. So in Winnipeg, we have this is the movement disorder clinic that we have. We have the movement disorder specialist, physiotherapist, occupational therapist, speech language pathologist, dietitian, deep brain stimulation clinician, nurse, and social worker. This is a one-stop shop for for the patients. Dr. Hobson lobbied the government to have the multidisciplinary clinic here in Manitoba, because he believed that having the allied healthcare team together with a specialist at one visit is important, because we can talk to each other, we can work together to improve patients' care. In Manitoba, the catchment is expanded. We see patients from Nunavut, northern Manitoba, eastern Saskatchewan, and western Ontario, and also some northwestern Ontario as well. We often, for patients with remote community, before the pandemic, patients will have difficulty getting to Winnipeg when there is when there's winter. The roads are not available, or flights are canceled because of snowstorm. And we are dependent on Manitoba Telehealth service, which is a part of the Winnipeg Regional Health Authority, or Manitoba Health, that basically allow us to actually talk to the patient over video conferencing. But the patient were required to actually visit a nursing station or hospital in the community. And we need to examine the patient over video. And this was, at the time, was suboptimal already. There was missing components of the exam. We can only see a particular region. And other part is that their videos are two-dimensional. There's some, when you visit the clinic, there are subtle findings that we can see. And also the neurological exam is a very important part that we could not perform over a video. And we have to, neurology is a very, the specialty that's still relying on physical exam and knowing how your power, your strength, your movements are in person. And that's why most of the time we bring patient in for the first visit. And for patients who need botulism toxin injection, there's no way around with video conferencing, and patients need to come in for the injection. I tell you about what we have in Winnipeg, but resource, just like Canada, how wide we are, how diverse we are, the resources available in each province, the clinic setup, and the operation may vary from city to city or to province from province. That was what we have prior to the pandemic. And with the pandemic, it caused us a lot more challenges, and particularly, I tells you that how important that your patient, your relationship to us. So now with mask, face shield, we can really read facial expression. We can, our voice projection change, and we cannot hear clearly. And now we're asked to do Zoom meetings or Zoom MS Team meeting with our patient. Internet connections. I had a patient. I had to see a patient who was in Ontario, Northwestern Ontario, and the internet connection was quite poor, and I could not see the patient or hear the voice properly, and I just had to pick up the phone and just talk, and the phone the phone had better voice quality than the internet connection. So, but at the same time, we can appreciate the body language of your body language, or you can appreciate my body language in terms of if there's any concern or if there's any question that you may have. And in addition to that, our staff in the clinic are short. Many of them, not just in our clinic, but in the hospital, they're asked to go to different area of their work. Our clinic physiotherapists, occupational therapists to redeploy to the hospital to help out in the hospital. The EEG staff in the hospital are being sent to the COVID ward to help out. And in some province, I'm aware that some physicians are being sent to work in COVID ward because we have to be redeployed. And this obviously reduces your accessibility, and I definitely can affect the relationship between patients and doctor. And in the first wave in March 2020, we had widespread shutdown in Manitoba, and for 3 or 4 weeks there was no in-person visit. Most of the time we will basically perform telephone appointments, and the testing capacity was reduced. No MRI or MRI delay. Then remote community had lockdown, so a patient cannot come down to Winnipeg or to any center to get their injection. And then different simulation surgery was halted. And because of the allied healthcares are being redeployed, access was reduced, or you cannot see the physiotherapist in person or the speech and language pathologist in person. So we have to modify our practice. We have to be reliant on our patients with the health information. It was difficult for us to perform assessment, particularly neurological exam. So we just must say, it's difficult for us to perform neurological exam today. Is it okay if we have an availability when things opening up, we'll bring you back in the clinic and reassess you at that time. And most patients that we talked to were understanding of the challenges we're dealing to. When this happened, we had a difficult time trying to use Zoom or Microsoft Teams because a lot of the time the reason why telehealth previously was done was just that we want to protect your information. Zoom does not have the same security as telehealth in the past, and internet connection at home may not be reliable, and many people do not have technologies available. And then there's also differences in hospital, provincial, local restrictions. So some clinics which is part of the hospital, they had to shut down. Some private clinics may be able to open that, but that's also dependent on the clinic and owner and manager. Clinic visit becomes shorter because we want to have less time between you and us so that we don't pass on the virus to you, so less exposure time. But also the clinic capacity become reduced because we want to make sure that there's not a lot of patients waiting in the waiting room, and there's increased risk of transmitting the virus. And again, some people have to cross provincial borders, like people from Northwestern or Northeastern Ontario coming to Manitoba, because Manitoba had mandates, hey, if you're coming for our province, you have to stop for, you have to isolate for 14 days. So this is a study that was done in Germany with the first lockdown in March, in patients receiving botulism toxin therapy for their dystonia. They have 45 patients in the study, average age about 62 years old, and the shutdown was 6 weeks. So that there was a delay of 6 weeks 6.6 weeks in patient on average, 92% felt that they have increased muscle cramps, 82% increase in pain, and 40% experience reduced quality of life because of that. After the shutdown, about 66% of them perceive botulism therapy as more important than before. So I must say that not you, what you're experiencing and what you're going through are important to us, and what you're experiencing and what you're dealing with are we understand what you're really going through. So obviously in Manitoba, because of the pandemic, we had delay to provide botulism injection. But fortunately, the number in the first wave were low, so that we were able to open up fairly quickly to bring patient in clinic and try to catch up with their injections and to their treatment. And when the second wave hit, there was widespread lockdown, but policy changed. You don't have to completely shut down the clinic. We can bring in urgent cases, bring in patient in person to provide injections. And there was no complete shutdown. But similar challenge occurred that we just because there's mask, there's body language, and the clinic visit were shorter. There was it obviously caused a strain in the relationship, the patient-doctor relationship. So what did we learn? So not all patients require in-person visit beside the first appointment, particularly in other conditions. So in some patients with Parkinson's disease, we can talk to them over the phone, and they would be able to tell us what their symptoms are like, and we can manage the medication over the phone. Some patients prefer telephone visit or virtual visit because they're from remote community. It's a challenge for them to come down, or it's difficult for them to find transportation to the appointment. They spend less time driving or looking for parking or waiting in the waiting room, and they don't have to pay for the parking or transportation costs. So we potentially, after the pandemic, we could consider, in-person visit alternating with virtual visit in the future. So that kind of challenges to the way that we practice. But at the same time, we have not found out a more creative way to provide botulism toxin injection, and it's still being done in person. We have not found out a better way. But for us, patient-doctor relationships are really important. The honesty is our best policy, and we encourage our patients to call us within 24 hours. And so prefer patient to call us, and then we'll try to answer within 24 hours. Obviously, this may not be possible, depends on the resources being available. And if you have a concern or problem, just give us a call. We will try to book urgent appointment with you. The trend moving forward is that virtual appointment will become more mainstream and improve accessibility. E-consult is a new web-based technology system that allow family doctor to reach us better with questions, and then we can try to answer those questions, so reduce wait time in some situations. So how do you make the most of your neurologist visit? So helpful information for doctors to improve your symptoms. How have you been? How were you the last year? Your last visit? Any change in your medication? Any change in your health? Did the treatment have any benefit? Or did it work the same as last time, or better or worse? And how long did your botulism toxin injection work? And to what extent did it work? Any side effects? And if your treatment was delayed during pandemic, how did you cope with it? We like to learn because we can share with other patients what you say. And do you have any questions from the last visit? Important note is that you have to get in touch with us. Many of the neuro movement disorder special care for many patients, and a friendly reminder is always welcome. Get in touch with us, our allied healthcare team. Ask questions at your clinic visit. And what if I cannot reach my neurologist? Your family MD can really help. So some of the questions are how or where can I get help for my mental health clinic during the COVID-19 pandemic. In fact, mental health is utmost very important, and COVID-19 pandemic can add additional stress, anxiety, isolation, and reduce accessibility haircut provider and make you feel more stressed. People often feel stressed because a lot of things are out of their control. But remember, we are in it together. You can reach out to anyone. You don't have to reach out to your movement disorder specialist, but we're welcome. You give us a call. We're only a short phone call away. But anyone that you're comfortable with family doctor, specialist, social worker, nurse, trusted friend, family member, we will connect you to the right person if we cannot find out or we don't know. Does my dystonia prevent me from getting COVID-19 vaccine? And the answer is no. There's no evidence that having dystonia prevent you from having the vaccine. But remember, if you have autoimmune condition or allergy, then you have to be aware of the components of a vaccine. After the vaccine, some people can experience headache, muscle ache, chills, low-grade fever, and these symptoms could temporarily worsen your dystonia. Are people with dystonia more vulnerable to COVID-19 infection? And the short answer is no. The patient with generalized dystonia and require constant care in personal care home. Being in personal care home would increase your risk of contracting the virus. But that is to the extent of how you're at risk of dystonia. And that's due to being in the nursing home, but not because you have dystonia. Does having dystonia reduce the effectiveness of COVID-19 vaccine? And what about medication to treat dystonia? And the answer is no. In the study that they published, they did not mention whether the patient with dystonia will enroll in the trial or not, because they were being very broad and general in the category. But there is no data to suggest that having dystonia or taking medication for dystonia will reduce your efficacy of your medication, of the vaccine. So did anybody with dystonia have different symptoms when they contracted COVID-19? In general, if you have a neurological condition, having an underlying infection would worsen neurological symptoms. So if you have Parkinson's disease, if you have a urinary tract infection, you just feel crummy and less well. Even when we're healthy, we have a cold, our body feels weaker and doesn't function the same way. In patients with general dystonia affecting their breathing, having COVID-19 pneumonia could worsen breathing, and they could potentially have more breathing difficulty. But that's generally. So that's all I have. I'd be happy to answer any question that you have, or I would like to have you clarify any question that you have. I would like to thank again for Archana and Stephanie in providing me this opportunity. It's an honor to present in front of many of you, and that's all I have.
Perfect. Thank you so much, Dr. Nguyen. We do have some time for questions, but before we do that, I just thought to build upon your presentation, we can highlight just a few of the resources that are available to the dystonia community. I know that in your presentation, I think a few things that I think were really key and things that I'd love the community to make sure they take away with them is some of the silver linings of the pandemic. So, I know this has been a very difficult, trying time for all of us, and I think particularly the dystonia community, but, looking at what kind of doors this has opened in terms of, the opportunities for increased telehealth, and that being a silver lining. I think the other piece I just want to touch on is the fact that, at DMR of Canada, one of our main goals is to really empower the patient community to feel that they can have really honest conversations with their doctors. And I think when you were talking about how important the relationship is between doctor and patient, and how important it is for doctors to be able to sort of see and correspond with their patients to get a better sense of what their needs are, I think that's always been really important. But I think one of the things that you touched upon was just how important it is for patients to bring a really honest, true conversation to their doctors, whether that be in person or via telehealth. So, that slide that you presented on really, how are you doing? How are you feeling since your last treatment? What is on your mind? I know that in other conversations with other doctors, we've talked about, potentially the need or the encouraging patients to almost keep a diary of their own health in between their visits with their doctors. And so this potentially could provide an opportunity for the community to really, I think, get used to the idea that they'll be able to feel empowered and be able to speak with their doctors about what their needs are. I know that it looks like we're having some technical issues with our screen. I don't know how this looks to you guys, but I'll just quickly touch upon a couple of the web links that I think are going to be really important for the community. So dystoniacanada.org/resources is a really important page for you guys to check out. I just want to mention that there are things like recorded yoga sessions that we've held previously for the dystonia population. And I know that there are other support resources that will be particularly useful, including some of these questions that Dr. Nguyen has touched upon in his presentation that were really as a result of the questions that you guys asked when you registered. So I just want to remind you as well that the second webinar series that's specifically speaking on pain management, which continues to be a challenge for the community, is coming up on February the 18th. So if you haven't already registered for that, please do so. I know that Dr. Nguyen also touched upon, anxiety and stress and all of the side effects that we know that sort of aggravates dystonia symptoms. And so I just want to remind this community that if you aren't already aware, we are also hosting 2 sessions that are specifically speaking about mental health. The first one is taking place on January the 27th, and you can find that information available on our website. Those are just some of the resources that are available to the patient community. Now, I think we can dig into some of the questions that have been asked throughout the presentation. One of the questions I think you've already covered, Dr. Nguyen. I'll just I'll make sure that this hasn't already been touched upon. There have been a number of questions that have come in around, the connection or whether or not there's any consideration between patients who have dystonia receiving the new COVID vaccine. It looks like that is not a consideration. There is a question here about should there be a wait time between having neurotoxin injections and receiving the vaccine for COVID-19? Do you have any thoughts specifically on that?
I don't think there have been any study have looked into the botulism toxin injection and COVID vaccine injection. I know that with the COVID vaccine injection, in some of them, they mentioned in some of the vaccine, particularly the Pfizer vaccine, they usually ask you if you have any immunization 14 days before the 14 days before receiving the vaccine. Other than that, the getting botulism toxin injection is often non-immunogenic, meaning that having the toxin into your body does not trigger your immune system response. So long story short, answer is that I do not think having botulism toxin around the time that you're getting the vaccine should be an issue at all. But at the end of the day, this is something that we are very unfamiliar with. This is sometimes this treating this pandemic. There's many things that we aren't sure, and we haven't really looked into it. I hope that that's clear enough, Stephanie. If you want me to tell in a different way, that's perfectly fine as well.
No, I think that's great. And, obviously there are the known side effects, or, the side effects that you spoke to regarding the COVID-19 vaccination. And obviously sometimes, after a neurotoxin injection, patients don't feel great, within the first day or so. So potentially spacing those things out. But, at the end of the day, to your point, we've never done this before. So
For sure. Yeah.
Okay, thank you for that. Another question that has been asked, it's quite specific. Will low dose levodopa provoke dyskinesis?
It's difficult to understand the experience of levodopa with dyskinesia that we often have is in patient with Parkinson's disease, and that usually high dose of that is due to the rises of the levodopa dose in your bloodstream that cause people to experience dyskinesia. How levodopa affect dyskinesia, especially at low dose in dystonia, we're not 100% sure if that is a consistent finding. And without knowing the underlying condition that the patient experienced, it would be difficult for me to comment. But I would suspect that low dose dyskinesia would be less likely to be caused. So low dose levodopa would be less likely to cause dyskinesia.
Okay, thank you for that, Dr. Nguyen.
Yeah.
And there's a follow-up question to that, which
Yeah.
is, does low blood pressure have any effect on dystonia?
That's a very good question. I must say that I haven't really thought about it. I haven't really read about it. I can answer that question if you could give me an opportunity to look up that question and can get back to you. But in general, I do not think that low blood pressure would worsen dystonia.
Okay, thank you very much, Dr. Nguyen. We can definitely follow up with this particular member after the fact if you do have the opportunity to get some more information.
For sure.
I'll take one more question, which we received it in a number of different forms, so it's quite a popular question, and it's something you touched upon in your presentation, but I just want to give you the opportunity to enhance your answer if you see the need to do so. It's around anxiety. So a number of patients have asked, what can I do to ease anxiety during this time? Or, when I start to feel stressed out, what are the best things for me to do to help relieve that tension?
This pandemic had brought a lot of uncertainty in our lives, in many of our lives. And the fact that you're uncertain about your future, what will happen moving forward, many people are experiencing some level of anxiety. And what you're feeling is normal. How you deal with anxiety varies from one person to another person. When I talked about anxiety and stress, sometimes they are related. In particular, most people feel stressed because they feel that they cannot control the situation. And especially during the pandemic, we cannot control what's going on with the pandemic. I would suggest that in many ways, to regain some form of control, one way is to seek help, and the help is not in the form of medical help, but help as in if you can talk about and see and explore what is the underlying driver of your anxiety, what is the underlying driver of your stress, and do you have someone who you can trust to talk about it and figure out what help you can get for the stress or the cause of stress that you are experiencing. And I think that is that I would usually, and that we are here for you, and your doctor, your allied healthcare workers are available to you. I know phone call or accessibility can be an issue. We try to get back to you, and if we do not know, we will try to connect you to the right person and find the right resources. Our social workers are quite good in our clinic, and we often connect you to her if the issue becomes housing, the issue becomes financial stress, or the issue is, finding, filling out forms or unemployment incomes or unemployment or financial support from the government. Sometimes it's there, but you're not sure what the forms or what are available and how to really go about doing that. And not everybody is can access the form, or not everybody is able to know how to fill the form correctly. And our social workers are available, and I'm pretty sure that most doctors know how to access social worker in their practice. We're very fortunate in our clinic that she's available next door or to us, so we can always go walk over and talk to her. But I understand that every province and territory and health clinic setup are very different. But that would be my recommendation there.
Thank you very much for that.
Yeah.
And just to add on to what you've said, Dr. Nguyen, just about the support services that exist, I missed out on a very important support piece, which, beyond just the foundation, and of course we're here for the patient community as well, and always willing to do what we can to either connect you to a movement disorder center or specific movement disorder specialist. We also have a really incredible network of support groups that exist across the country, including one in Winnipeg. Many of our support group members and leaders are on this webinar with us today. So, just a reminder to those of you out there that are feeling anxious and stressed out that please consider seeking support within the dystonia community, because it is a network of people who are really committed to helping you out at this time. So I want to take this opportunity to thank you so much for your incredible presentation. You obviously spent a lot of time on it, Dr. Nguyen, and I'd like to turn things back over to Archana to close.
Thanks, Stephanie, and thank you again, Dr. Nguyen, for that wonderful presentation. That was definitely very useful, and a reminder to the community that we will share those helpful information or questions that Dr. Nguyen shared earlier in his presentation for easy download on our website. And my apologies for the technical difficulty with the slides. I've been alerted by my colleague that there are some boxes on the presentation that's hindering your view of the slides. My apologies again for that. Just a few quick reminders. We'd like to remind you that DMR of Canada is not recommending any specific course of treatment for dystonia and COVID-19. Any new experimental treatment mentioned here may be relatively new, exploratory at this time. So please speak with your movement disorder specialist or your GP about any course of treatment to ensure it's right for you. And a quick reminder regarding the resources and support that you have found helpful or would like during this time. You can share that in the chat box, or you will also have an opportunity to share these responses anonymously through a survey at the end of the webinar. And we'd also love to hear about your feedback or your thoughts on this webinar. So please do share that with me directly through chat. I will be on the webinar till the end, taking in your feedback. And I also want to take a moment to thank Allergan and Abbvie Company for their very generous support of this webinar series. Again, a recording of these webinars will be available on our website, as you see, www.dystoniacanada.org/COVID-19 impact. Thank you, everyone, once again, for joining us today. And thank you again, Dr. Nguyen, for taking the time to talk to the dystonia community today.
Thank you for your time.
Thanks, everyone. Have a great afternoon.